everybody. Thank you so much for tuning in. This is Faith with the Mental Health Association of Central Florida. And this again is our week's episode of Coping Together. I'm very excited about today's topic, which pretty much covers intervention and the concept of a new hope of recovery. And with me today to talk about this topic and really focus on, what to do when you feel like you've kind of done everything for your loved one are Ryan Shu and Dave Gulden. And Ryan is the Community Outreach Director with Orlando Recovery Center. And Dave is with A New Hope Recovery Services. So with that being said, thank you guys both so much for being here. And could you tell us a little bit about yourselves and your organization or companies?
Thanks, Faith. Yeah, I'll jump in. My name's Dave Gulden. I am a licensed therapist and the lead interventionist at A New Hope Recovery Services in Winter Park, Florida. We provide counseling, interventions, case management, and ongoing consultation and family therapy. We also provide assessments and a whole multitude of counseling services.
All right, and Ryan?
Yeah, and so on my end, I'm the Community Outreach Director with the Orlando Recovery Center, and I also represent our parent company, which is Advanced Recovery Systems. And I've been with Advanced Recovery Systems for over 5 years, and I've been in the field for about 10 years, and pretty much since graduating from the University of Central Florida. We've got 10 treatment centers across the country. Most are right here in Florida, and we offer life-changing treatment for the treatment of substance abuse and co-occurring mental health. And my role specifically involves reaching out to individuals in the community that need help through our relationships in the community and with other healthcare providers in the area. And I get to work with people like Dave whenever interventions can be beneficial for a family. And a really big part of my job is to help break down barriers preventing people from getting treatment. So thanks for having me.
Okay, well, thank you both so much for introducing yourselves. And so I think I'll kind of start just by asking, I think a lot of people have a misconception or confusion as to when is intervention necessary? So is that something you can tell us a little bit about?
Sure. So it's a question I think every family member or friend or loved one of what we'll call the impaired patient or the identified patient, which would be someone who's suffering from a substance use disorder, which also referred to as an addiction, or a mental health issue that is clinically impairing their life. So there are consequences as a result of their use and or lack of treatment. And so if you have someone in your life that you're close to and you don't know what to do because of their drug or alcohol use or behavioral mental health issues, I think the question is, one would have to ask themselves, what would I be willing to do to save this person's life? And if that's something that's crossed your mind, or a feeling of hopelessness because you want to so badly to help this person, then you're probably talking about an intervention, meaning there's a problem, there's a solution to that problem, which is going to be treatment, but you have no idea how to get your loved one there. That's when you would be thinking about potentially contacting an interventionist and or a treatment center like Ryan works for.
Okay. All right. Ryan, anything to add?
Yeah, one thing that we hear a lot, and maybe you've heard this before too, is that you can't help somebody if they don't want help. But really, that couldn't be further from the truth. There's a lot of things that you can do by working through people like Dave. And, loss can be a big motivator. Like if you lose your job, like if you get in a car crash, or even worse, you overdose, die. But you can work with people like Dave to take action before something drastic happens like that. And really it's something that can make a huge impact. One of the things that I wanted to show, we've collected some data from our patients at Orlando Recovery Center, and we took a look at reasons for admission. And here, I can share my screen here. This slide here, this is the data from March 2019 to March 2020 at Orlando Recovery Center. And these are the top reasons for admission. And you look at the number one reason at 58% is a family or relationship ultimatum. And, you know, exactly what intervention helps with. And so really, that's one of the best ways to get a loved one into treatment is by working together with close family and friends and putting a plan together for them to get help and for everyone else around them to support them.
Okay. All right. Well, thank you for that and for sharing that information. So to kind of clarify, so an ultimatum, just for those of us who may not be super familiar with the term, basically means kind of the all or nothing, like you either get help or XYZ is going to happen.
Yeah. So like if it's let's say it's a wife to a husband, you know, saying, look, you know, if you choose not to get help, you know, I love you, but I can't continue to enable you, and I'm going to have to move out and with the kids, and I'm sorry, but I can't keep this going any longer. So something along those lines.
Okay. So intervention basically then is, it's not like the first step. It's kind of once you've tried a lot of things, like we said, you feel like you've tried everything. That's kind of when the intervention becomes necessary. Is that what I'm hearing correct?
Well, I think it depends on the case. I think certainly when an intervention is warranted, it's serious, meaning we're not at a point where someone is either actively seeking help or needs outpatient therapy. You know, they're in kind of the later stages of a substance use disorder, like a severe presentation. And maybe they have tried to go to treatment or mutual help group support, and it's just not working. And the way that I kind of conceptualize interventions and psychotherapy in the substance use disorder and mental health field is based on a concept called the addicted family system, which is basically a very simple way to look at it. Is say you have an impaired person using drugs and alcohol. Well, everyone around that person is kind of playing a role in that system. And what we would want to do with the intervention is get that person help. But in order to do that, you'd have to affect systemic change, like change the way everybody kind of operates around the use or the behavior to promote kind of like overall system health. So everybody kind of gets some help, because as most people know, someone who's using drugs to that level or with a severe presentation of a mental health issue, everyone around them is suffering along with them, especially when that person won't help themselves or seemingly won't help themselves. And I would think intervention, or the way that I kind of look at intervention is, you know, we're dealing with mental health disorders, substance use disorders, which really are thinking disorders. They're generally considered brain diseases. And the problem is, it's just not that simple that someone would want help and actually follow through with help based on the rewiring of their brain and really the distribution of neurotransmitters and things. And so if you're a family member or friend deeply concerned, you just feel powerless over this person's health and not taking care of themselves, and you fear for their lives. And an intervention is really taking action to kind of change that narrative from use or impairment to health and recovery.
Okay, thank you for that clarification. Can you guys hear me okay? I don't know what that was.
Yeah, there's a noise, but it's all good.
Okay, sorry. Well, thank you for that clarification, Dave. I really appreciate it. I especially appreciate you kind of clarifying and also, you know, adding to that, because it is so true that, when someone has a substance use disorder, or like you said, a severe presentation of mental illness, and they aren't necessarily getting the treatment that they may need, it really does affect everybody in that system that you described. So that being said, to both of you, what kind of questions, if a person is feeling like their loved one may need an intervention or qualify, what kind of questions should that person be asking, whether it's directly to that loved one or to someone like you or themselves, to identify how severe that need is?
Yeah, and I'd first say that most of the calls that I get, it's when it's pretty clear that an individual needs at least some level of treatment, you know, whether it's outpatient, inpatient, or telehealth. But by the time they've called me, and probably by the time they've called Dave too, lots of times they've, you know, witnessed like a dangerous behavior or harmful pattern that's going on. Um, but in terms of figuring out what level of care a person needs, we at Advanced Recovery Systems, we offer a pre-assessment, and there's no cost for it. And our clinicians will review it. It takes about 20 minutes over the phone. Our clinicians will review it, and they'll be able to recommend a level of care that's based off of the ASAM criteria, the American Society of Addiction Medicine. So that's one really good tool to use. But you know, there's also more formal questionnaires and tools and assessment tools that can be used. I know just one of the many is called Tweak, and it's a list of questions. You know, I know the first one is, you know, how many drinks does it take you to feel the effects of alcohol? This one's more based around alcohol. Or, you know, has any of your family and friends been concerned about your drinking or using in the past year? So there are tools like that out there. But, you know, I'd say the simplest thing is, you know, pick up the phone, just call someone like Dave or our team at Advanced Recovery.
Okay.
Yeah, and very similar to Ryan and his facility and company. I sometimes get calls from family members, and they're calling for an intervention, but really after discussing with them kind of the case or what's going on, I'll consult with the family. Sometimes we'll do a formal assessment of the identified patient, which is very different than an intervention, or at least how I kind of facilitate the intervention process. So someone would come in, and I do like a 2 or 3 meeting mental health and substance use disorder evaluation. I also do them for attorneys and civil and legal matters, but also for, you know, families just trying to get some more information in the same way Ryan was talking about with different assessments. I use toxicology testing to really determine a baseline for what's going on with that person. Because the truth is, the person might really not require an intervention at that first phone call, and even better to help them, you know, maybe when they do need outpatient therapy or a mutual help group support program. Sorry, there's a leaf blower coming down, so it might get a little loud. Anyhow, so in that case, I think it's a real benefit to have you know, a therapist, a family therapist working with a system where everybody's concerned that this is going to get out of control. So I think if you're listening and you have someone that you're concerned about, you know, just kind of ask yourself, like, is it getting any better? What have we tried? What have they tried to get better? And I would just kind of want to empower all of those people asking those questions to say, if it seems hopeless or it seems like there's nothing you can do about it, it's just not true. I mean, that's why treatment centers exist for mental health and substance use disorders. And then therapists like myself and interventionists like myself, I mean, we are motivators. And so there is hope out there, because it absolutely seems like a hopeless condition. when you're watching someone harm themselves or put themselves in danger.
Okay. No, thank you for that. And so I guess with that being said, with right now with what we're facing with still a bit of social distancing and having to be at home, one of the questions I have for you, I guess, kind of falls in line with that. And as it's true for not even social distancing, but if a person is kind of looking to have an intervention for a loved one, how do they support themselves and the other loved ones in the household in that phase of intervention at home? Like, it's got to affect the home environment a little bit, right?
Absolutely. And in preservation of time, I could go into like the different intervention models. You can do a quick Google search to understand. But you're right. So there's a lot of stress and anxiety that goes on with, I say the family system, but that really is the people closest to that impaired loved one,
Right,
the identified patient. What we always say when someone calls us says, I would like to, intervene on my brother, we say, okay, we want, 5 to maybe 10 people, max 10 people in the room with that person during the intervention. And the way we kind of discern who those people would be is, who would be sitting at the front row of that person's funeral if this goes that way. And then obviously I do screening with every individual to make sure that they're appropriate to be in the room. But to your question, the pre-intervention process, so I'm working with that system to meet and to address their concerns and offer treatment to their loved one. Part of that is really building in mutual support throughout the group to really support each other, and then identify what they need to do for themselves, regardless of the outcome of the intervention. I tell families, look, if we're going to do this, I promise you that the minute we intervene on your loved one, this is going to change. Like, they may not go to treatment that day, and that's part of the intervention process. And that's a whole other story we could get into. But like, systemic change will happen at that moment because the family system is taking action regardless. And so they're going to go to Al-Anon or Nar-Anon, which are mutual help groups for families of addicted people. They're going to go see this therapist. They're going to stay in family therapy. And I'm working with a family right now that I placed a loved one in treatment in Ocala. And we've been doing Zoom calls and phone calls to kind of bridge the gap during the COVID era. But certainly, I work with them throughout treatment as their loved one is progressing and kind of serve as a go-between with colleagues of Ryan's or someone like Ryan, who is kind of the treatment center point of contact for me, and then really for my patient's family system.
Okay. Brian, anything to add?
Yeah, and just to recap too, like, of course, hiring an interventionist whenever possible that can really walk you through things, walk your family through things, and be there for you. And seeking guidance from other mental health professionals. I know in Orlando here, we've got some really great peer support groups. I know Peer Support Space is a great organization that provides some support with that. And there's Al-Anon meetings you can attend. And it's important to remember that it's an ongoing process too, and to really not be afraid to ask for help, because the numbers show, the chances are that, most families are affected by mental health or substance abuse in some form or another. And so, it's something that just needs to be treated objectively, just like any other medical issue. And I'd say it's really important for the family to remember why they're doing it. They're doing this because they love that person, and intervention is really an act of love. And so I think if you kind of keep that in mind throughout the process, it'll make things a lot easier.
I think that was a really good thing to point out. And again, I appreciate you both sharing this information. I am not versed in intervention at all. So I, like a lot of our viewers, my purpose is I want to learn about this stuff, and I want to be able to be able to, help a loved one if I see them in that kind of position. So I really do appreciate you both taking the time out of your days to talk to me. And one of you actually, I think it was Dave or maybe it was Ryan, kind of touched on my next question, which is you made it, you mentioned that they may not go to treatment right away, the person who's the intervention is being done for. So I guess, the question I guess then that I would ask is that feeling of, you tried in the beginning to help this person and you kind of feel like you failed. Like, what is the next step and what's the strategy from that point? Because it seems like that's obviously not the case. There is more to come after that.
Yeah, so, in the research that Ryan showed, which is fantastic, because you're really getting kind of like from people in treatment, like what was their motivation, and really that is the idea. Really, in treatment, what you're looking at is trying to, decrease resistance, improve motivation for people to take action and get better. But for those scenarios, really, the truth is, sorry, let me back up. The idea, the word ultimatum was used, and depending on kind of which style of intervention you employ, that is a part of it, meaning consequences, because the truth is, there's very little one can do to force anybody to do anything. There are some provisions out there, and some kind of last ditch efforts that you can use to motivate someone. But at the end of the day, it's really difficult if someone's thinking is impaired to say, hey, you really need to quit because we all love you so much, and that's kind of the first part of the interventions that I do, which are very much informed by my career as a therapist and a family therapist, but really are kind of the original Johnson model or method, where we really appeal in a loving way to the people who need help, and it's a very carefully choreographed process, because typically you have someone who feels really they might be impaired and they might not be thinking well, but they're also really dealing with a lot of shame and typically a lot of trauma, and they're just not feeling great about the fact that they're addicted to drugs or what have you, especially in substance use disorder treatment. But the consequences or ultimatum, really, I try to build in that support feature too, meaning, if you have someone living in your house who is impaired, who is, the term we say, holding you hostage. And I talk to many families where there's a family member, and over time it just becomes an inhabitable situation with someone living there drinking, abusing them more or less, and so there's interventions I do where I say, look, if you're not willing to evict them or kick them out, like, there's no point in doing this. That has to be on the table. But I also say, don't put any consequences on the table you won't enforce. And that's a really difficult thing. And I work with people to kind of find what's true for them and what they will do. But as important as that is that they get their own help. It's a difficult thing if you've intervened on someone and then they're not going to treatment. But if you've kind of cut out any support or the term enabling of them, people feel good about that. They feel like they're not contributing to the disease or the destruction of their loved one. And just a quick thing about enabling, this word gets thrown out a lot. In my experience working with families, enabling starts out as a loving act. I have my spouse and they're impaired by alcohol, and they want more vodka, so they drive to ABC in a blackout, and then they come back, and then I'm scared for them. I'm scared they're going to hurt someone, hurt themselves. So from that point on, I drive and go get them vodka. And people say, why would you do that? Like, you're keeping them sick. And the truth is, that's a loving act. Like, people enable because they love their kids and they love their parents and they love their friends. It's just over time that becomes normal. And the intervention, when I talk about changing the narrative, is trying to identify, like, all those maladaptive behaviors in the system and how do we just stop doing that in a way that's safe, but also doesn't contribute to anything other than recovery. So that might have been a long-winded answer to your question, but everybody needs help in the intervention. You know, it might be the smallest amount, but and then that intervention group, that family system, needs to support each other, whether or not the person goes to treatment.
No, thank you very much. I don't know why is anyone else hearing that on the end? I'm sorry if the volume's doing something weird, but thank you so much for your answer. And it wasn't long-winded at all to me. I think that you touched on really important things, especially again with the term enabling, things like that, like you said. Ryan, do you have anything additional to add or comment on that?
Yeah, I think Dave gave a really good answer, and I'd say most interventions that I worked on in general end up in the individual going immediately to treatment. I feel like looking back at the ones that we've worked on together, Dave, I think every single case has been successful in terms of that person going immediately to treatment, which has been awesome. But yeah, there are those cases that are just really tough, and that doesn't happen. But as long as the family is sticking to their plan and doing everything they can, lots of times it's just a matter of time before that person, decides that, this is what's best for them and that they need to come in and get some help and get back on the right track.
Okay. Well, thank you both so much for being here and for talking to me about this topic. Those are all the questions I have. Was there anything additional that you guys wanted to add? If not, it's okay.
No, just that, I'm here for the Mental Health Association, and anybody watching this would love to provide my contact information and be available to help. And I appreciate you having me.
Okay. Dave, anything?
Yeah, likewise. It's a really difficult time on so many levels right now. I won't even go into it. You just turn on your news source of choice, and people are doing the best they can. We're all trying to get through this together. But really just in those situations where you feel hopeless, reach out to someone, whether it's Ryan, me, the therapist you haven't seen in a while, someone in long-term recovery. There is help out there for these people that seem like if they don't want it, or if they don't want to change or they don't want help, that it's pointless. And that's the point that I try to drive home, whether I was as my time as a therapist in treatment centers or as an interventionist, that if you really have an impaired person, there are going to be times where they're incapable of wanting to get better. And what I say is, you don't have to want to get sober or clean or enter recovery. But after you're there for a while and your brain starts to heal and you start to kind of develop coping skills and things, then you have to want to stay clean and sober or healthy. It's a little bit more difficult when you have some specific mental health issues, but that's the kind of the essence of an intervention is it's absolutely a loving, life-saving act. And like any other disease, it can be treated and is absolutely treatable.
Okay. All right. Well, thank you both again so much for being here. For those of you watching, thank you as always for tuning in. If you have any questions about this topic, please feel free to let us know in the comments below, as well as if you have any concerns about anything. If you think your loved one may be in need of an intervention, please feel free to reach out to us at Mental Health Association, and we can connect you with individuals such as Ryan and David. Or you can also get their information. We're going to put that in the comments as well, so you can reach out to them. They really care about what they do. They are great in their field, and we are just so lucky that to have had them come on our show. And if you guys have any topics you want to see from us or anything like that, please let us know in the comments below. Please feel free to reach out. And just as always, thank you so much for watching Coping Together, and we'll see you next time. Thank you.